Okay, well, I want to welcome everyone to the Western Center for Agricultural Health and Safety seminar series. We have a seminar the first Monday of the month at 4 p.m. throughout the academic year. And today we're going to have a great presentation from our founding director, but first I want to go through a few housekeeping items. You should have received notice, but just to make sure it's clear to everyone, this seminar is being recorded and you'll be able to watch it probably tomorrow if you want to on YouTube. All participants are muted. During the presentation, please feel free to use the chat function to ask your questions. Moderators will collect questions for the Q&A session at the end of the presentation. Setting up Spanish interpretation, which will be available for the presentation. If you need Spanish interpretation, please choose Spanish from the interpretation language selection below to hear the translation. That is still being set up. All of the presentation today will be in English. Thank you so much. And now let's turn over to, again, I'd like to introduce Dr. Marc Schenker. He's the founding director of the Western Center for Agricultural Health and Safety. And among the many areas of research he's done around farm worker health and safety, heat stress is one that has quite a bit. He's a critical thinker in this area. And so I'm happy to introduce him to present on heat stress risks and outcomes among California farm workers. And Marc, go ahead and share your slides and you can get started.
Okay, well, thank you very much, Heather. This is going to be on a report on several years of work that we've been doing on heat stress in farm workers. I'm going to go through a lot of material, but hopefully tie it all together and show some future directions at the end of the presentation. Just so we're all on the same page, I'm going to start with classic heat-related illnesses and what was known about those in the past decade or so. Then we'll move to occupational heat stress, which gets us to the farm worker story, and focus in on occupational heat stress among agricultural workers. I'll talk about some of our current research, and then getting the message out and changing the curve. So here's the picture of classic heat-related illness. It's a spectrum going from mild heat rash to fainting to cramps, exhaustion, to more critical outcomes, heat stroke. And when you have heat stroke with a body temperature of 104 degrees or higher, there's a 50% mortality, as well as multiple organ system dysfunction that occurs. This is a medical emergency, and the ultimate tragic outcome is death in those cases. So this is a spectrum, and of course, what we'd like to see is little or is no stroke and death, and that we push this to the mildest symptoms. But we'll talk about this in the course of the presentation. Now, here is a picture of the classic heat stroke cases in California that were recorded. This is over a few years ago, but to give you a picture of where this occurs and in whom in California. And you can see the Central Valley and Imperial Valley are the location of most of the cases. Those, of course, are the high temperature areas. It was mostly older adults. And there were a lot of underlying chronic diseases, cardiovascular, pulmonary disease, psychiatric problems were very common. And then when we get down to the social determinants, only one person had been using air conditioning prior to death. 74% no air conditioning or functional and not used. In other words, the picture was of the elderly dying in the hot areas of the state. Now, Basu looked at California heat wave mortality over a 4-year period. These were over 200,000 non-accidental deaths and clearly showed an association. For every 10 degrees Fahrenheit increase in temperature, there was a 2.6% increase in cardiovascular deaths. And this is multiply adjusted, so it's an independent association of temperature with these fatalities. The risk was greatest in the elderly over 65 years, in infants, and in African Americans, but no difference by gender. So we start to get the picture of the population impact of heat on health and fatalities. This has been repeated in a systematic review of studies over from 2001 to 2008. And what you see in all these studies, an independent association of ambient temperature and mortality. And the risk of death is from chronic cardiovascular disease, respiratory, cerebrovascular. But once again, the vulnerable populations, the elderly and infants, African Americans, women in this case, and lower socioeconomic status. So here's the picture of classic heat-related illness. Age is a risk in infants and the elderly, lack of air conditioning. Social isolation has come up as a determinant. Pre-existing medical conditions, impaired mobility, low socioeconomic status, and housing characteristics, particularly the absence of air conditioning. Now, just to carry this a little bit further, as we're all aware, climate change is a reality, and I'm not going to talk about it in this talk, except to say here are the projections for the percentage increase in heat-related deaths in US cities. And this is for 3 timeframes, the 2020s, 2050s, and 2080s. And you can see for the 2020s, there's about a 20% increase in heat-related deaths observed or projected for US cities. And that goes to a 40 to 60% increase in the 2050s and up to 100 or 120% in the 2080s. So this is something that is with us and is going to increase in magnitude in the population. Now, way back in 2016, if we can remember back that far, the White House did a report on climate change and human health. A very comprehensive report, and they looked at a whole range of impacts of climate change. Temperature-related deaths and illness, air quality impacts, vector-borne diseases, the spread of hazardous vectors, water safety, water-related illness, and so on. And, you know, it's a very comprehensive report. What struck me was there's no mention of occupational outcomes, and I'll get into how much of a deficiency that is, but there was less than 2 paragraphs about workers and their exposure to excess heat and health impacts from that. And, you know, unfortunately, this is a reality that occurs, is that the occupational hazards, even though they're greater, get ignored or shortchanged. Well, in California, we can trace the acute awareness of this to 2005. In August, there was a heat episode, extreme temperature lasting a couple weeks, and there were 4 or 5 deaths occurred among farm workers. And Arnold Schwarzenegger, who was the governor, said, "This is a tragedy. We're going to do everything it takes to prevent this from happening." And amazingly, within a week, passed emergency occupational regulations for heat illness. And I have to say that California has been the leader in regulatory efforts to reduce heat illness, and we'll get into that. But even today, there are only 3 states, California, Washington, and Minnesota, that have heat regulations. And Minnesota, it's only for indoor workers. And there's no federal regulations or standards, even though the effort has been made to get federal OSHA to come up with regulations. Well, the heat episodes continued in 2006. There was several deaths and heat illnesses, non-fatal, that were analyzed. And this is a Cal OSHA report, which is very instructive in getting at this risk in farm workers. Average ambient temperature was 100 degrees. Core body temperature average was 102, and some were much higher. 88% of the workers had available water. and 78% had a shade structure available in where they took their breaks. But 80% had been on the job for less than 4 days. And this gets at one of the risk factors, which is lack of acclimatization, which was severe in these cases that were analyzed. And then 54% were felt to be doing strenuous work, and another 19% moderate work. And I'll come back again and again to this theme, because one of the key risk factors for heat stress in farm workers is metabolic heat load, or work-generated body heat. And in here, 54% were doing strenuous work. 2008 was another bad year. Here are 6 deaths from heat fatality in agricultural workers. And, you know, when we look at these, there are a few things that stand out. One, it's affecting both men and women. 2, for the most part, this is working age. So 17 to 63 or 64 years of age. And 3, they're all Latino. In other words, the population of California agriculture, which is 90+% Latino, is being impacted by this. Also notice the 17-year-old, I'll talk about her again later, but this is an illness that is not the typical age-associated impact. And so we can see this in young workers as well as old. Well, the CDC did an analysis of occupational heat exposure in 2008. They analyzed over several years 423 occupational heat fatalities. And there are a few striking findings from this report. One is that agricultural worker deaths were 20 times the rate for all industry. In other words, you're 20 times more likely to die from heat stress if you're an agricultural worker than if you work in any other industry. The vast majority were in crop production, and most, I say question mark all, deaths were among immigrant workers. And I say that because they had place of birth for about 80% of the workers, and it was all foreign born. And the other 20% were missing, but probably were immigrants as well. So high risk in agricultural workers, immigrant workers impacted in crop production. Now, there are a few other things from this report. One was this interesting finding that the rate of heat fatalities in North Carolina was 5 times the rate in California. And I like to think that that's in part because of California's more conscientious approach to these things. It's not acceptable, the rate, as we'll get to, but it's certainly not as bad as North Carolina. They didn't get into the reasons for this, and you can speculate about those. And the other disconcerting finding was when they analyzed the rate of fatalities over 5-year time intervals, there was a clear upward trend. This ended in 2006, and the rate hasn't been reanalyzed in this form. But again, with climate change, we can expect this to increase unless there are appropriate interventions made. So what are some of the personal risk factors for heat stress illness? Well, I've been talking about lack of acclimatization. Dehydration is another one. Lack of physical fitness and obesity. Heavy clothing that insulate and increase body heat. And metabolic heat load. And we'll talk about these in our data. But I wanted to bring in another idea here, which is the precarious worker. And this is the worker who doesn't complain when they're not feeling well and is at greater risk because of it. And this is typical for the immigrant farm worker who knows that his job or her job may be vulnerable. If they complain, they work hard, they just want to make their income and go home. And they're at greater risk because of it. So if we look at the variety of factors that impact heat, body heat, there's ones that cause gain of heat and ones that cause cooling. You know, ambient air temperature and humidity and reflected solar radiation, all increasing heat, wind, depending on its presence or absence, evaporation and sweat and respiration effective up to certain temperatures, radiation away from the body. All these come into the formula for what impacts the body heat, but the one that I'm going to focus the most on and the take-home message of the lecture is this one, metabolic heat. Metabolic heat we're seeing is really the thing that is the most critical in terms of increased risk in agricultural workers and in other workers. Now, I put this in, this is from a study by Tord Shellstrom, who's done a lot of work in this area, and it shows the percent productivity loss at different temperatures, ambient temperatures. And so you can see down here at 70 to 80 degrees, you don't have any loss of productivity, but very quickly when you get up to 90 degrees, you get 50% loss in productivity. And this has been shown repeatedly. And it's another impact. And, we're doing some work on the economic impacts of heat, and this certainly comes into the formulation. Okay, so let's talk about this metabolic heat load, and I'm going to talk about where we see exertional heat-related exposure and illness. And there are three populations. One is the military, second are trained athletes, and the third are farm workers. And if we play the game, which one of these is different? Well, it's clearly the farm workers. Why is that? The military has a top-down command structure, they have resources, they have the ability to protect people. Athletes are trained and monitored and in peak condition, and can be usually in a situation where heat stress is not going to be a problem. And workers don't have these benefits. They don't have the resources, they don't have the top-down authority watching out for them. They just are doing the work and exposing themselves to the heat. And that's why they're the most vulnerable. We don't hear about heat stress deaths in the military. They don't let it happen. And in athletes, the same. But in workers, we're seeing the tragedy of this. Which brings me to Maria Isabel Vasquez Jimenez, one of those deaths in 2008. And I tell this story because it's illustrative of this risk. Maria was a recent immigrant from Mexico. She was working in the grape vineyards of near Stockton, California, alongside her fiance, and she didn't feel well. And she complained to the labor crew boss and said, "I'm not feeling well, can I rest?" And he basically said, "Maria, you either work or you don't have a job. And you better continue working." And so Maria continued working, and pretty soon she passed out, and she was revived, and eventually she was sent home where her body temperature was going up and up, and she went to a local clinic and then to a hospital, at which point her body temperature was over 104 degrees, and she was in heat stroke. She had several cardiac arrests and died. And oh, by the way, she was also pregnant. The tragedy here is that this was a totally preventable outcome. I mean, rest, water, and shade are the key elements of prevention at literally no cost, and yet they weren't offered to her because of her precarious status as an immigrant farm worker and the work situation that she was in. So this is a tragedy, and it's, as I say, particularly tragic because it was completely preventable. 17 years old. So that gets me to our research that I'm going to go through, and this has been, we've called this the California Heat Illness Prevention Study, CHIPS. There are multiple components of this investigation. Questionnaire survey in our Mendota population-based sample and in our surveyed farm workers, qualitative data, focus groups, and key informant interviews, a whole range of physiologic field studies that we've done, economic analyses with Dr. Dan Sumner from Ag Economics, And now we're into prevention and intervention translational efforts. How do we change the situation and reduce the mortality and morbidity from heat stress? So I'm going to talk about each of these and give you a flavor for our findings and how they relate to California. And, you know, I have to emphasize again, this is California specific. And the results would probably be different if we were in North Carolina or Florida. But we're fortunate to be in California. And while we have the effort, we could probably do better. So our field study has been at 30 different farms in the summers of 2014 and 2015. This shows the 15 farms that we went to in 2014. And you can see that they're quite representative. The Central Valley was covered from north to south, Oxnard, and then the Imperial Valley. This is a volunteer study, volunteer population, but we had good participation and all of the efforts were approved by the Institutional Review Board. The Physiologic Study looked at hydration by body weight and blood measures, work rate, initially heart rate, and then with an accelerometer. Clothing, we've done studies on infrared penetration of heat in different clothing, and we photographed clothing that was worn by the farm workers. And then this, the core body temperature. You can see it here in the bottom right is a pill that the workers swallowed the morning of their day being monitored. And we did this because we found that no other method gave a reliable core body temperature. Rectal temperatures weren't feasible. Oral temperatures, skin temperatures, none of those were reliable in these farm workers. And so we went with core body temperature. And then questionnaire data, as I mentioned in a couple points. Now, I put this in just to remind me of the fabulous workers we had running this study. They were mostly UC Davis students, and they had to get to the work site before the workers and set up and measure them and monitor, you know, have them swallow the pill and take their body temperature measurements and weight and so on. And when the work shift starts at 6 o'clock or earlier, they had to be there at 4 o'clock or 4:30 in the morning, you know, using headlights for lighting. And, you know, they did a fabulous job in running this study. And you can see also the geographic locations that they went to for this. So they were fabulous. And Diane Mitchell, also our study coordinator, was right on it and made this thing possible and successful. And these, of course, are our subjects. Non-standardized clothing, a variety of crops that were looked at, all production agriculture in California. And, you know, we didn't manipulate their job tasks in any of the work that was done. So what about the questionnaire results? Well, these start to get very interesting. This is the experience of heat-related illness in 587 workers. 48% said they had ever experienced heat-related illness symptoms in the heat, and the mean was 5 times over their career. So half of them had experienced symptoms. And of the majority, 59%, were unacclimatized when they last had heat-related illness symptoms. And then, shockingly to me, 42% said they just continued to work regardless of the symptoms. 54% said they now protect themselves by drinking and resting more, working less intensely, or changing clothing. But you can see where we're at. Unacclimatization is a risk factor. It's clear in our population sample. And 42% said they just continued to work. The absolute wrong thing to do, but for various reasons that we'll get into. What about thirst and heat-related illness and work attitudes? Well, in this sample, the same population, 72% said they are at times thirsty to extremely thirsty when they work. And I'll just tell you that thirst is a late measure of dehydration. It's not an early measure. And you shouldn't be drinking to treat thirst. You should be drinking to prevent thirst. And then interestingly, do you think you drink enough? 97% said yes. So they're thirsty or extremely thirsty, but they think they're drinking enough. What is your level of concern about heat-related illness at work? Not concerned at all, 45%. And then only very concerned, 11%, and a little concerned, 42%. So we have an indication of poor behaviors in terms of risk of heat illness in these data. That is the presence of thirst, thinking you've drunk enough, not slowing down when they feel thirsty. And, these are all behaviors that are increasing the risk of heat-related illness in our population. So Gail Wadsworth led a group of the California Institute of Rural Studies on qualitative outcomes, and they did 10 focus groups throughout California, 170 farm workers in 3 languages. 3 languages were Spanish, Mixtec, and Triqui. And they also did key informant interviews with farmers, farm managers, and farm labor contractors. So this is to get at things that one can't see in the quantitative data that we collect as epidemiologists. And there's a lot of findings from their work. I don't have time to go through them, but cultural beliefs in water are very important. In men not wanting to look weak or slow down others, women wearing excessive clothing because of undue attention from men in the workplace. Drinking water can make you sick. Hot-cold syndrome is something that was observed. The belief that cold water is hazardous in a hot climate and you shouldn't drink cold water. And then lack of acclimatization, not recognizing early heat-related illness symptoms in men, and training materials not adapted for low literacy or cultural needs. Prefer video. So a whole variety of cultural behavioral factors that increase risk in this population. So to summarize the qualitative studies, there are beliefs about water temperature and consumption that shape in part participant choices, how often they hydrate, the type of beverage consumed throughout the day, beliefs about cause and effect between drinking water and sickness may reduce water consumption, conflict in terms of the benefits or risks of hydration. And then this hot-cold syndrome and belief that shifting body temperature too rapidly can be dangerous and harmful to the body. But here's the other message that came out of these qualitative studies, and it's in an article, probably my favorite titled article in my whole portfolio. And it's called, "We Just Have to Continue Working, Farm Workers Self-Care and Heat-Related Illness." And it gets at the dynamic that the workers don't feel they have a choice. Just like Maria Isabel, they have to continue working or they don't get the income, they don't have the job, or worse, they're fired or they're deported even. And, the power relationship is one where the employer has all the cards, or the labor contractor, and the worker has to do what they're told. Now, I have to say that this is not uniform. I've worked with some very conscientious and great farm owners and managers, and, but this is a reality, and this is what came out from these focus groups and key informant interviews. So what about the physiologic field studies? Well, this shows you the complexity of temperature and humidity during a typical workday in the summer. And you can see that relative humidity is up as high as 30% in the early part of the day and then falls down to 10% during the day. Dry temperature, bulb temperature, starts down at 20 degrees centigrade and goes up continuously through the day. And the same with wet bulb globe temperature, and steady increase over the day. And, you know, we were monitoring dry temperature, humidity, wet bulb globe temperature to get at the risk factors for the health outcomes that we looked at. We also monitored workload. This is a graph of a personal monitor of heart rate. And you can see the smoothing, but even still, this is very messy data, and a lot of statistical manipulation was needed to use this. And eventually, and so this is a smooth core body temperature, but every time they take a drink, the temperature can go down and it comes up. And eventually we shifted to accelerometers because they're more reliable and usable data for workload. Oops. And then basically, I showed you our core body temperature monitor, the pill that they had swallowed. We have environmental conditions, work rate, hydration, clothing, and demographics, age and sex of the individual. And we put these into models for a couple of health outcomes that I'll show you now. First one was risk factors for dehydration, and we defined dehydration as a loss of over 1.5% of pre-shift body weight. And you see several interesting findings here. Women were significantly less at risk of dehydration than men. Body mass index was not significant, and age was not significant, but working piece rate was a significant increased risk for dehydration, and a high work rate as measured by the accelerometer was also an increased risk, statistically significant. And then, ironically or interestingly, more knowledge about hydration risk was associated with greater risk of dehydration. So knowledge alone wasn't preventing dehydration. The other outcome that we looked at was elevated core body temperature over 38.5, normal body temperature, of course, 37. And we didn't want to see anybody going much above this, but we did have it in 5 to 7% of the workers. And what were the risk factors for this? Well, once again, women were at less risk. Dehydration was not a significant independent risk factor, nor was age or body mass index. Ambient temperature was significant. Higher the temperature, the greater the risk of increased core body temperature. Shift length was a significant risk factor. And piece rate was increased, but not statistically significant. But what was very significant was high work rate. That is, the higher the work rate, the greater the risk of increased core body temperature. And we put in a lot of other variables, clothing and so on, and those did not turn out to be significant. So this is what leads us to this belief that work rate is a predominant risk factor for heat illness in California farm workers. Now, as a side study, Dr. Sally Moyse analyzed our data in terms of acute kidney injury. This is her findings from our population. So this is increases in serum creatinine meeting the AKI standard criteria for a stage 1. And stage 1 is reversible. This is not permanent, and we don't expect this to be permanent except with repeated acute kidney injury, it might be. Piece rate came out as significant. Diabetes was increased risk, borderline significance. Age, years in farm work, not significant, nor was high blood pressure. So you know, the multiple organ system damage may be a precursor. And why are we concerned about this? Well, globally, the chronic kidney disease of unknown origin is thought to be primarily due to heat stress exposure. This is an epidemic, or I might say pandemic, in hot climates, certainly.
Hi, everyone. I am contacting Dr. Shanker, and hopefully he will be back with us in just a moment. Thank you.
Okay. So I'm sorry about that. I don't know what happened, but dehydration, lack of knowledge of symptoms and response needed, and cultural beliefs, hot cold syndrome, and the other things that I mentioned, poor nutrition habits. The overall implications of this, the often outweighs the self-protective actions. Heat-related illness prevention trainings by themselves are not being remembered or not actualized, and we have to understand why. And we need alternate economic incentives should be developed so that they're protective of heat stress. And piece rate is the one that I would focus on as coming up as a risk factor in our population. Interventions need to be culturally appropriate and training methods must change. Decreased emphasis on text and increase on visuals and audio video. So let me finally get to the translational projects we've been working on for the past few years. The first of these is economic analysis of the association between production and high heat. This is aimed at employers, but in our findings, this is not protecting your employees is not only socially wrong, but it's economically wrong, and it's going to cost you more. The development of apps to assist supervisors with heat-related illness prevention for both workforce and work individuals. Incorporation of our findings into evidence-based training and video education are all what we've been working on. Now, the message goes out, and Teresa Andrews is our lead train the trainer person who's been doing wonderful work. Webinars and media. We have a new phone app on heat stress prevention and video focusing on economic benefit to farmers. And I'd like to show you this video because it's fabulous, but it's not ready for release. But it's an effort of Common Table Creative, and it goes to Frank Muller's farm on Woodland, and we'll be making an announcement about this, and it's a great piece that makes the social and economic case for effective heat illness prevention. This is a couple of images from our phone app, which is now on iOS and other platforms. And then, of course, the California heat standard needs to be revisited. Even though there have been 2 revisions to this standard, and we lead the country, I think we can still do better from the things we've learned in our work. And, you know, we'll be working with Cal OSHA to do that. So to summarize and finish up, heat-related illness remains a risk of illness and death, especially for the most vulnerable outdoor workers. It's expected that climate change factors will increase the risk of this outcome in the future. The risks for heat illness are multifactorial and require diverse approaches addressing heat gain and cooling. And metabolic heat gain is perhaps the most significant risk factor for heat-related illness. And then in the classic occupational health phrasing, we need education, engineering, and enforcement efforts. It's not one approach that's going to fit all. And we have to be sensitive to the cultural beliefs and perceptions of the workers who are doing this work and putting themselves at risk. And finally, this is 100% preventable. We shouldn't have any deaths from heat illness. And it's a tragedy when one occurs, let alone many. So I want to thank, we had a lot of co-investigators on this on the left-hand side, and then the students and Teresa Andrews working on it. They're a great crew, and the work couldn't have been done without them. And I'll finish it there.
Wonderful. Thank you so much, Mark. And thank you to everyone for your patience as we had a little bit of a technology blip. We do have a question, and it's the one that I had actually typed out myself as well to pose to you. So we're wondering if you can speak a little bit more about what you might want to improve or update in Cal OSHA heat illness prevention standard, and what changes you think should be considered.
Well, there are several things. I mean, it's important to point out, you know, again, that we're ahead of the country on that. The requirement for shade, for water, for available rest breaks, but a lot of those things are voluntary, they're not mandatory. And I think one thing would be, you know, factoring in mandatory rest breaks. In fact, I was interested to see that a lot of workers, especially the piece rate workers, don't even take a lunch break. And, you know, so mandatory breaks would be one thing. You know, what else? The the availability of rest breaks is optional, and you get into the dynamic of people asking for breaks versus being required to be given them. And, you know, that's because of the pacing of the work. And I think that's an area that could be looked at as well. You know, the workload is a tricky one. I mean, we know that increased workload increases risk, and yet how do you manage that? And I'll just leave it at that.
So, and right, the mandatory breaks are not required below 95 degrees, but they become required over 95 degrees. And the issue, perhaps from the research, is that it's that below temperature when people are oftentimes acclimatizing. Is that where you think they should become more available?
Well, acclimatizing is one thing, and that's the amount of time you've been in the hot climate before you do heavy work. And, you know, the 95 degrees is well within the range where we see heat-related illness. And, you know, as I've tried to explain, it's a combination of multiple factors that go in. So if you're at 90 degrees and you're doing heavy work, you're probably at risk, increased risk.
Right. And just a reminder to everyone, feel free to put questions or comments in the chat, please, and we'll be happy to share them with Dr. Shanker. Something that I've been often curious about is the finding related to piece rate, and whether how you factor that in with your findings, and what recommendations might be relevant for Cal OSHA or other states thinking about adopting a heat standard.
Well, you know, I'm not a regulator. I'm not a standards person. I'm a scientist, and, you know, it's clear that doing piece rate is putting people at increased risk. And how you get around that by regulatory, I mean, all these standards are compromises of sorts. And, you know, what I want to prevent is the person at increased risk. And, you know, in our studies, that person is in the hot climate and doing piecework because they're working harder. Their metabolic work rate is greater and their metabolic heat load is greater. So how you finesse that is something that needs to be thought about.
Thank you. Another very timely question has to do with the increased risk of heat stress due to wearing either cloth face coverings for COVID protection or the N95s for wildfire smoke exposure protection. Do you have thoughts on how that should be handled in the field?
Competing risks. You know, we didn't look at face masks. We did this prior to COVID, and clothing was a minor factor. It wasn't a major factor. If I have to, it didn't come up in the multivariate modeling. And I think, you know, that I would be guessing, but I don't think, well, I don't know. We don't have the data on face masks, and, you know, you're creating different risks. I would say, though, that the heat risk is serious. I mean, we're seeing fatalities and you know, cardiovascular disease. You know, that's something that we need to prevent and focus on.
Another question from a participant: is heat-related illness a major contributor to global burden of chronic kidney disease?
Well, you know, that's a great question. Certainly in the epidemic areas, it's a major contributor. In Central America and Sri Lanka and other hot climates that are agricultural, those areas, yes, it is a major contributor. Is it in other climate conditions, other situations? Well, I don't know of any data that have looked at it, but I've been curious about that to see if kidney disease fatalities increase with temperature, for example.
We don't have any more questions currently, but anyone is welcome to add them. Mark, is there anything else you want to plug while you have the few minutes? Oh, okay. Well, here's another very specific one related to heat-related illness. Do you have any thoughts on heat-related illness contribution to sudden unexplained nocturnal death syndrome?
Ooh, not in the general population. Yeah, I don't know. The usual fatal pathway is shock. And shock is a sudden collapse of the, critical organ systems, cardiovascular, cerebrovascular, renal. But I don't know specifically with regard to, how do you say it? Sudden nocturnal fatal death syndrome. I've previously done work on housing conditions in farm workers. And let me tell you, air conditioning is a luxury. And we know that people have looked at different patterns of heat and risk of heat illness. And the absence of nighttime cooling is a key risk factor. And of course, how do you get nighttime cooling? Either you're fortunate enough to be in a climate where it occurs, or you have air conditioning. And, in the absence of those, you're increasing your risk of adverse effect.
We have a question from a colleague down at UCLA asking about whether there are any comparative studies of ag workers versus other outdoor worker populations, for example, construction, and whether there may be insights about the heat illness risks specific to farm workers.
I don't know direct comparisons, but my feeling is that ag workers are the least protected of the outdoor workers. They're the most vulnerable, either because of their immigration status or their, lack of contract or lack of union or lack of protection. And I think that their fatality rate for heat-related illness is highest among outdoor workers. The construction workers are going to have shade or possibility of shade more often than farm workers. Farm workers are right out there in the direct sun.
Well, so with last few minutes, one thing I'll do is plug the new discussion guides and training resources that Dr. Schenker's team and those of us at the Ag Center are developing specific to heat illness that we hope to be able to disseminate widely within the next month or so, and definitely in time for next year's heat season. And I think that also the video that Dr. Schenker referred to is I think something that's helpful and compelling for employers in thinking about how to maintain a safe workforce. And so that's something else that we look forward to sharing with everybody.
I just would end by saying it's not a simple approach. We need engineering, education, and enforcement. And no one approach by itself is going to solve this problem, but it's a problem. And, it's sad that there's no national standard, even though that's been an effort, but, it doesn't go anywhere. And so, some states, 5 times the fatality rate in North Carolina is very telling. And there have been problems in Florida as well, and you get the picture. But, I don't want to place the burden all on education. because in fact, education is not the sole cause. And, you know, you're putting people in difficult situations and you need to protect them.
Absolutely. Well, thank you. I'd like to, on behalf of the Ag Center, I'd like to thank you, Dr. Shanker, for presenting to us today. For those of you who would like to share the video with others in your network, it will be posted on our YouTube channel tomorrow. And please consider signing up for next month's seminar on Valley Fever among farm workers with Dr. Steve McCurdy. And with that, I will say have a great afternoon, and we look forward to seeing you next month. Bye.